We are recording and ready to begin.
Tim, can you guys hear me?
Yes, we can. And we can see you. Councilmember Garland, do you want to do the call to order?
Thank you very much. I will do the call to order. Good afternoon, everyone. I'm calling the first meeting of the Human Services Community Safety Committee to order. I'm gonna go ahead and I think.
Okay, I'll go ahead and review. I'll go from that on the agenda so everyone's there. Understanding that we are the Human Services and Community Safety Committee. We're going to go ahead with option 2, review meeting minutes. Since there is no minutes and this is our first meeting, should we just go right into public comment?
Joel, I'm going to go ahead and finish reading the call to order. My screen went blank, so I lost my place, so let me go. It's important to understand that no formal votes or decisions about city programs, policies, or budgets will happen here. Our role is to explore various topics with staff and stakeholders and community members, and to make recommendations to our council colleagues. We want this process to be transparent, inclusive, and easy for you to be able to be a part whenever you choose to be. And you can share your thoughts with us by filing a comment card about any item on the meeting agenda or by reaching out to us directly with any thoughts or questions or ideas. We need you to fill out a comment card in advance that can be read into the record on any agendized item. The link to the comment cards can be found on our committee webpage at www.tempe.gov/HSCS. And you will also find contact information for committee members and staff for non-agendized questions as well. And our public comment cards, the next item on our agenda is the public comments. This committee welcomes public comment according to the Arizona Open Meeting Law. The committee may also discuss matters listed on the agenda. Matters brought up by the public under public comment that are not listed on the agenda cannot be discussed by the committee. A 3-minute limit per person will be in effect. And Tim, do we have any comments for this meeting?
Council members, no, we do not.
All right, thank you. All right, Joel, I'm turning it all over to you.
Thanks, Doreen. You're doing such a great job on this. So we'll go ahead into committee session items. Agenda on 4A, it's current items and updates. Right now we have no current items and updates as we are a brand new committee. Committee session item 4B, new items for considerations. 4B1, introduction of council committee priorities. Tim, are you going to go ahead and just list those off?
Yeah, Kristen, if you want to elevate me, I can share it unless you have it.
You are elevated, so you should be able to share. I just need to stop sharing for you to do that.
Oh, okay. No, I do not have the option yet.
Do you just want the work plan
Yes.
up? Okay.
Councilmember Navarro, do you want to go through these one by one?
Yeah, if we could, Tim.
Awesome.
I'll go for it. So, priorities indicated and indicators. Priority to ensure community feeling safe. So we're going to go over item A on the list. So priority ensuring community feeling of safety. So further efforts to and recommendations made by the Public Safety Task Force to working with Tempe Police Department to further increase police service satisfaction from 73.8% to a targeted 90%. Item A3, examining opportunities to reduce fatality and serious injury crashes, including examination of Vision Zero initiatives. Item A4, explore and report on national best practices for COVID-19 mitigation strategies. And I'm sorry, this is moving around on me. Municipal governments. And then priority item A5, examine the interior departmental solutions for park safety. So Tim, am I taking it? We're just going to start with, or just take a look at these priorities and indicators first, and then have some sort of presentation on it?
Yeah, council member. I know Assistant Chief Pooley is on the line to talk about item A1, because that is going to be a practical presentation likely for the next meeting in March. So,
okay.
Assistant Chief Pooley.
Hello, Council Member Garland and Navarro. Happy to be here today. Just to give a report out on the Mayor's Public Safety Advisory Task Force. So we have concluded our last meeting, which was January 27th. We had a total of 7 meetings. There were 22 participants with people from inside and outside of Tempe that participated on giving us some recommendations. We have the recommendations that were given, and we are discussing those and evaluating many of those topics internally and externally to provide something for council that we can be prepared to share as well. Any questions?
No, perfect. It sounds like we are just going to have another scheduled meeting on this and wait for you guys to have your items ready to go.
Yes, sir.
Doreen, anything else?
No questions. Thank you, Commander Pooley.
You're welcome.
Nice, thank you. So then we'll go to, with that being said, we'll go to item A2, work with Tempe Police Department to further efforts in increasing police services satisfaction from 73.8 to a targeted 90%. Tim, who do we have on this one?
We have Assistant Chief Pooley again. If he has anything he'd like to say, this is one of the higher level goals for this council committee. So I don't know if there's anything practical to be said at this point. Assistant Chief.
Yeah, I would just add that we're continuing to work with internally, externally with different partners to continue to increase the satisfaction. That's one of our top priorities and goals also here within the department as well.
Got it. Thank you. With the next item, A3, examining opportunities to reduce fatality and serious injuries, crash, including examinations of Vision Zero initiatives. Chief Pooley, are you on this one too?
Yeah, I can speak to this. Our traffic unit, as well as all of our field operations, we continue to evaluate where we are having collisions and high frequency areas. When we determine that, we're putting more resources there to include education, enforcement, and engineering, as well as just evaluating the outcomes of everything to make sure we can continue to have this as a top priority as well.
Gotcha. Doreen, any questions on that? Go ahead.
Yeah, I have a question. Commander Pooley, can most of that crash or all that crash information be found on our city's dashboard?
Yes, it can.
Okay. Thank you.
Anything else on that item? All right, we'll go on to A4, exploring the reports on national best practices for COVID mitigation strategies for municipal governments. We'll be talking on this, Tim.
I don't know if we have staff available to talk on this one. This is more of an exploration for partners to talk on this. So I think this is a conversation between both of you, council members. Maybe Rosa and her department, but we had a conversation last night to bring additional stakeholders. So this is the first meeting, and we don't have many stakeholders outside of city staff, but this would be one where they would talk on, including the county, ASU, U of A.
Right. So exploring those best practices with those stakeholders.
Yeah, through the stakeholders.
Right. Okay. no, obviously, I think that's great. In fact, we, I know within the city of Phoenix, they're trying to partner with various other people to make sure that we're kind of doing the best practices throughout the city of Phoenix, but also with other cities. I think so. I think this is a great, step in the right direction. Anybody else have anything to add to this?
Joel, just during, so I had also mentioned that I want to reach out to the National League of Cities to see what other cities are doing across the country so that we can have that information also. So I will bring that back to the meeting.
Perfect. That's awesome. Anything else?
No, sir.
Okay, so we'll go forward with that. We'll wait for that to come back and let them go ahead and explore those options. Let's see, A5, examining the interior department solutions to park safety. Inter-department. I'm sorry, I'm reading on a tiny screen.
This is Tim again. So this is in result to the last work study meeting that we had last week. I believe it was last week. And this would be a good opportunity for staff to come and present rather to the, outside of the entire council body. This is an opportunity for staff to update us based on the council direction that they received at the 218 work study session on this item.
Okay, gotcha. Yep, and we already went through his priorities last meeting. So Doreen, anything on this?
No, but I look forward to the update from staff. And so will that be at our next meeting then? We'll look for an update on this information, Tim?
I believe so. Councilmember.
Okay, thank you.
Okay. Awesome. All right, so we'll go into the next category, priorities and indicators. B, priority, improving the capacity of the city to respond to the growing opioid epidemic and to end opioid abuse and misuse. So item B1, we'll go over that real quick. Identify areas of improvement for COVID-19 wastewater dashboards. What are we talking on this one here, Tim?
Hi, Joel. So this was in reference to one of the items that you had discussed at the council meeting. I know Rose is on the line. We haven't talked specifically on what the areas of improvement are, but that is what this item is. So Rose, I don't know if you have anything to add.
Well, I guess my first question is this correct to put it under this category?
I believe so, I guess.
Okay. I was just thinking with opioids. Okay, that's fine. Rosa, do you have anything to add to this? I know what I stated last meeting. Obviously we want to make sure that we're kind of breaking these demographical areas into better usable information instead of having a big, large, vast area that we're trying to get information from. So ideas or anything on this you can talk about?
Yes, actually, good afternoon, Councilmember Garland and Navarro, Rosa Inchowski, Director of Strategic Management and Diversity. And actually, we have been meeting. We just met this morning again with our water engineers and looking at what the recommendations of the sizing for the CIP regarding, which is the required structured money to break down the area 1, specifically Councilmember Navarro. I think that's what your direction, or at least that's what you had shared with the rest of the council. Right. We are having a follow-up meeting on Monday afternoon, trying to come up with some creative ways to distill that area into more manageable sampling, so the community will know specifically what is going on in their neighborhood. So we should have more recommended to hopefully Ken Jones and Mark Day, but trying to basically use our public money efficiently and taking consideration the recent annexation and the growth of the Novus district, making sure that we're keeping that in mind with the sampling as the city continues to grow. So I have been happy to give you an update in March. We'll have latest numbers and information for both of you.
No, that'd be great. We're looking forward to that. Doreen?
No, I think that's wonderful. I think that, we have really set the standard on what can be done when testing wastewater and sharing that information with the city, with our staff, and with our neighbors and our residents about what we're doing and what that wastewater is looking like, I think is really important. So Rosa, I really applaud you and your department for what you've been able to do with this, and I look forward to getting more information.
Thank you. It's been a team effort. Thank you, Councilmember Garland.
Okay, very cool. So we'll look for more information on that. So item B2, utilizing the resources of Tempe Coalition to further the city's mission and then to mitigate the opioid epidemic. Anybody on this one? Obviously, I know I brought this up within the council meeting, kind of utilizing those resources that Tempe Coalition has already been tackling, along with our mission that we've started a long time ago on the opioid crisis to try to help mitigate opioids. And as we can recently see, and in fact, even I had a Channel 15 did a little piece on it, we're seeing the trend going up. And it's curious with COVID happening, a lot of people at home with other, with that being said, people at home not getting out doing the normal activity, you're kind of wondering if there's a tie with the opioid epidemic or opioid use, and just so-called using drugs to try to get by for the day, and how this increase in fentanyl and carfentanil is actually killing people. Here we're starting to see a real tick up, especially within our youth. So we want to make sure that we're tackling this issue in cooperation with the Tempe Coalition, so we're not duplicating efforts, and obviously we're on the same path and pattern. And in addition to that, I know with AG and the committee I'm on over there, regionally, there's obviously big support on making sure that cities are engaged in this topic and that we stay engaged. So Tim, anything else, or is there anyone going to be talking about this here briefly?
Yeah, Councilmember. I know that Octavia Harris is on the line. I had spoken to her earlier today. Octavia, do you have anything you want to add? I know that the Tempe Coalition is going to be one of our valuable stakeholders in this meeting. I'm sorry, in this council committee going forward. But Octavia.
Yes, I'm here. Thank you, Councilmember Navarro and Garland, and thanks, Tim. So I'm not prepared to provide a lot of details in regards to what the coalition is going to be able to do going forward. But currently there is a committee that is actually led by Maria Gonzalez, who is with Care 7, and it's for a state opioid response grant that TCC secured for the coalition. And so there is a focus by the coalition on opioids in response to it, and trying to learn as much as we can about the community. There's actually a community survey that's open on the Tempe Coalition website, so that we can get feedback from the community, both adults as well as youth, regarding what the important topics are in the community. So being able to have that community feedback is going to be really important around this topic as well as others.
No, sounds good. Many of things come, up when I'm thinking about this, and obviously it is the communication, the cooperation that we have with not only us, the city of Tempe and the coalition, but also with the region on how we can help tackle these efforts, and we're not kind of utilizing different messaging. So I know there's a lot we can go into on this subject matter. In addition, using our wastewater analysis to help drive those areas, so we can start resourcing appropriately with Care 7 and the program, and getting information and feedback and data from that. There's a myriad of things we can really go into in exploration on this. So I'm really eager to start working on this one as we go forward. Doreen, anything?
Yeah, I'm just going to say, Octavia, I really appreciate the fact that you had talked about doing a community outreach. I think that's really important. That's one of the things I was going to talk about, is that I'd like to find some way to make sure that we are connecting with the community and asking these really important questions of them, to kind of help guide us and help drive this forward, so that we can really make a difference in trying to get rid of the opioid issues here in Tempe. So I'm really glad to hear that, and I look forward to working with you moving up. Thanks.
Thank you.
Okay, perfect. Some more to come on that one. All right, we'll move on. Item B3, establish establish a connection between Tempe Coalition and the City of Tempe's mission. Tim, what are we doing?
Councilman, there's a lot of bleed over from B2 and B3.
Yes. So I see that. So yes, there's definitely that coordination and tie-in. So we'll be working on those in sync. Item B4, examining the relationships between cannabis dispensaries and the reduction of opioid deaths. I know we briefly talked about that and seen some data out there from various other states that have already legalized marijuana and the reduction in opioid use. And I think that it's an opportune time, from what I'm gathering, to see that information, to see what and how the possibilities of legalized marijuana or medical marijuana and how it's helped reduce the opioid addiction. So from what I take it, Tim, more information to come on that?
Yes, sir. I would expect a presentation either in March or April on this.
All right, perfect. Doreen, anything?
Nope, nothing. Thank you very much. Thanks, Tim.
Cool. So we'll go to item C, C1. Priority, improve the city's ability to address growing issues of home affordability and homelessness in Tempe. And then C1 is to provide active management of the Hometown for All initiative. Any brief comments on this, Tim?
Yes, sir. Naomi, I don't know if you can speak to this. I know that this was a project that is being housed in this council committee, but I have not heard an update on where this is at. I don't know if you can provide council with that.
Yes, good afternoon, council members Navarro and Garland. We can provide an update on that, some timelines. Staff have been working on the initiative to make sure it's continuing to move forward since its approval in January. I'm going to have Levon Lamy speak to the timelines that we've put in place.
Good afternoon. So as it relates to the Hometown for All, we have an ultimate timeline where the full rollout and the MOU and presentation. What we're working on is lining up the quarterly reporting to mayor and council with the quarterly Housing Authority Governing Board meetings so that it all lines up with the housing updates. We are finalizing the MOU agreement between the affiliate and the city for exactly how those funds would be expended, what that agreement looks like as far as acquisition of existing units, rehab, purchase of land, and then incentivization. Once we get that finished, that would come back for review and approval to move forward with. We are also working through some draft documents of what budgeting process would look like, because we know that mayor and council want to be involved with, kind of the annual allocation of what those funds are. So we're kind of putting documents together that at this point are very closely going to resemble the CDBG funding process that we currently use, with the allocation recommendations and then the ability to review those and move things around before final approval. So we will be getting some of these things done in the upcoming weeks, with that kind of final rollout slated for April 15th with all of the final documents.
Doreen, anything?
Levon, this is Doreen. I'm sorry. When did you say that the presentation will be done? Is it something that you'll be bringing to this committee at our next committee meeting, or will it first be at the council meeting?
So as we continue working through the documents, we would be bringing them to this committee for conversation, and then just for lack of better words at the second, kind of the final formal rollout would be in line with the Housing Authority Governing Board meeting on April 15th.
On April 15th?
Yes, ma'am.
Okay, great. Thank you so much, Levon.
All right, perfect. Anything else? Seeing nothing. We'll go on to the next item, and I believe that's item C2, enhanced communication between regional partners and the city and between the city and stakeholders. What we got on that?
Yes.
Briefly, go ahead.
This is Tim. Yeah, that was terribly worded. I was trying to figure out a way to word this. This priority would be a good opportunity to hear presentations from regional partners for the residents of Tempe and staff on this call. So I'm thinking about MAG, East Valley Managers, Task Force on Homelessness, anything from the NLC, anything from the Arizona League. This is a good opportunity to kind of establish that connection for information.
Yeah, Tim, I like that, and it kind of goes on, a little bit on the little group that we're working on with all the different entities within the church communities to try to communicate, outside of the silos, so to speak. So kind of the similar concept maybe is the router and the connections to those cities and those resources and how we can enhance that. Does that kind of maybe spin in that area, I guess?
Yes, I believe that this would be a good place for that.
Yeah. Okay.
I would
Doreen,
also say
anything?
that would, yeah, I would also say that would include our local stakeholders also. So not just regional, our regional partners, but also our local partners, correct?
Correct. Yep.
Yay. Okay, that'd be great. Thank you.
Awesome. Thank you. Okay, item C3, examining the options of homeless shelters expansion within the city limits. Tim?
Hi, it's me again. I think Naomi, if you would like to speak on this, similar to our the park safety plan, we just had a presentation to the entire council body on this on the 18th. But this is a good opportunity for us to hear updates as we go along with that conversation. So, Naomi?
Yes, that would be correct. And so from the last council workday session, we know there are a couple of those shelter options that we'll be doing more research on. And so we'd be happy to bring that back to this committee as well.
Perfect. That sounds great. Doreen, anything?
Nope. Thank you, Naomi. I'm looking forward to that report. That was a very healthy and involved discussion that we had the other night. And I appreciate all of the work that your department has put into this to pull all those different options for us. So I look forward to getting more information later.
Thank you.
Awesome. Okay, sounds great. All right, we'll go to item D, priority establishing resources to meet the growing human service needs. So D1, working with staff and human service departments to catalog the city's social determinants of health and residents. Tim, any info on this right now?
Yeah, council members, a lot of these priorities are the direct result of the community mental health working group that was accepted into this council committee. So I think all four of these are going to be for Naomi and her group, if she'd like to speak. I don't know if you want to go one by one, but I know the first three were the direct result of the working group that's closed.
Yes, thank you, Tim. This definitely is coming from the work group, and then the Human Services Department staff have been working on identifying those social determinants along with the Community Services Department to establish a mental health and well-being performance measure. The lead on this is Paul Bentley. So I am going to hand it over to him to talk a little bit about his work there, the task force work on the social determinants and the mental health and well-being performance measure.
Thank you, Naomi. This is Paul Bentley, Deputy Human Services Director. As far as an update on these two items, they're very much conjoined. We have probably moving with the second bullet makes more sense first, which is we as a Human Services Department and Community Services Department have been putting a lot of time and effort into establishing a performance measure that really gives us a good understanding of the mental health and wellness of our community. And attending conferences and doing research and many other things, and really solidified that the social determinants of health is the best foundation for us to build on. And so then staff has been focusing on learning more about what those determinants are and specific indicators that we can measure. What we have found is that many agencies and entities have implemented their own variation of this, this tool. and they differ as many as there are organizations. And so it's really one of those things where it needs to be specifically defined and made applicable to Tempe. So to help us with that, we put in a grant application with the Live Well Arizona Incubator. And from that application, they recently reached out to us as of a couple of weeks ago saying that they would like to join us and work with us to, one, work through and define the social determinants of health as they make sense for Tempe, and then assist us in defining a specific performance measure that has indicators that we can gather the data on and report on to measure how the city of Tempe is doing when it comes to both mental health and wellness. There's actually a meeting scheduled this afternoon with the Live Well Arizona Incubator representatives. And so it's kind of that kickoff meeting of starting the conversation as to how we are going to go about doing this work. And we'll be happy to continue to bring that information back to this group. Thank you.
Paul, that sounds great. I mean, this is outstanding. I'm glad we're going down this road. I'm glad we're finding this information, looking into it. So outstanding. And we, for me, you know, obviously, and I think Doreen, this is going to be great for us to hear the feedback from this and going forward. Doreen?
Yeah, I was going to say that I appreciate the work that has already been done in this area by Councilmember Arredondo Savage and Councilmember Adams on their mental health committee of the whole that they had before. And they handed this off to Joel and I to put into this committee. And so I'm looking forward to learning more about this and walking hand in hand with our Human Services Department to see what we can do to make this better in the city of Tempe. So thank you.
Perfect. Okay, so we conquered D1 and 2. D3, creating a mental health roadmap to help assist residents with resources available to them from the city, nonprofit organizations, and other stakeholders. Naomi, anything else?
Yes, I think the mental health roadmap will definitely come out of the work that's being done with the social determinants in conjunction with the community services department. So, but we definitely want to have those conversations with our community partners, stakeholders, and nonprofits as well.
Awesome, sounds great. Doreen, anything else?
Nope, that's good. Thank you.
Okay. D4, examine the opportunities to establishment of a family advocacy center within the city limits.
Yes,
What do you guys got on that one?
Yes, council members Navarro and Garland. The Family Advocacy Center was a idea born or a project born out of our Family Justice Commission. They brought this forward as a recommendation. And then from there, we developed a task force that included Human Services, PD, comments and discussions with the commission, and then as well as ASU representatives. The task force has come forward with an outline of what this project may look like, and this will be going to the City Council for presentation on March 18th at a work study session. Paul Bentley can provide some greater detail on the reasoning behind and the thought process of why we feel this is important for our community, and added some details if you would like.
Yeah, that'd be great. Thank you.
Thank you, Naomi. So with the Family Advocacy Center for the larger group, this is an opportunity to provide trauma-informed services to victims of crime. This is a model that is used in many other communities throughout the nation. And it's one that from the commission's energy and desires, staff was tasked to explore the possibility of what that could look like here in the city. And so that's the presentation that Naomi mentioned that will be happening on the 18th of March. Specifically, what we're talking about is it's an opportunity to provide not only counseling services, victim advocacy, but also co-locate law enforcement investigators that are specifically trained on how to provide interviews in a trauma-informed manner, and also the gathering of evidence, as well as the utilization of a mental health, as a medical provider to conduct SAN exams and other form of exams necessary to support investigations as well as our victims. And so we're very excited about the opportunity to explore this option and how it is able to bring multiple functions together in one location so that when a victim of crime is traumatized, not only from the incident itself, we're not re-traumatizing them by having them drive through multiple locations for services, that everything is in one location. Services are specifically tailored to their needs and their family in a way to assist them in their healing, as well as to establishing how, to support them in the accountability of the offender.
Paul, is it, let me back up and maybe I missed it. Is this a mobile type of unit that would be able to go out and provide this, or is this a transportation to an area?
Thank you, Councilmember Navarro. This is a brick and mortar building. It's a facility. So
Gotcha.
It is one location, hopefully centralized within the city of Tempe, should we move in that direction. And that is able for folks to come to. But again, it's limiting them from having to go to the police department for the investigation, to Care 7 for counseling services and victim advocacy, to a different location for medical. It puts everything in one location. So again, everything is done in one place and one location to assist them. The other thing that's really neat about this is Arizona State University recently came on board as a partner. We're having communications with them as to what that partnership looks like. Initial conversations include staffing such as a victim advocate and detectives, but again, the details will be coming to the body of council on March 18th.
Awesome. That sounds great. I like it. Thank you. Doreen?
Yes, I would just say, Paul and Naomi, I'm so excited about this. I think any opportunity that we have that we can make sure that we are treating people with kindness and dignity when they've gone through something that has been difficult in their life. I am so excited that we're going to do this. A number of months ago, Councilmember QB invited me to the Family Justice Commission meeting, and I listened to them and listened to their Commissioner Mary O'Grady talk about how much they've really wanted to have this Family Justice Center. And she had mentioned to me that she came before the council in 2017 and they came before the council in 2019 to ask for a Family Justice Center. And I said, one thing I'd love is for you not to come back 2 years after that in 2021 and have to ask that you would really like to have this center provided. So I'm so excited that we're moving this forward, and it's going to make a big difference in our community for those people who really need it. And I'm so glad about the stakeholders. I'm glad ASU is going to be helping out with this. So great job, guys. I'm looking forward to the next presentation on the 18th.
Thank you.
Absolutely. Sounds great. Perfect. I think we're coming to the end of the agenda, Tim. Is that it?
Yes, sir. That's the end for this item. On the agenda was the item to introduce key staff members as well.
Okay.
But we've heard from a number of them.
Got it. So with that said, we have the introductions to what we're going to be going forward with or working on and supporting. In addition to that, getting some updates as we get information as we're going forward with this. This is going to be great. I think that I want to first tell everyone that's here, thank you. I mean, you guys obviously we're on the right path. We're taking care of the things that absolutely are great needs for our residents and our community to try to provide the services needed so that we do have a healthy lifestyle within the city of Tempe. So these are big effects that actually I'm hoping they're going to start trickling to other cities to use as a template to help out with their residents. But obviously we're also going to be engaging on a regional level to make sure that this information does go out on various things. Communication is probably the biggest key with all this stuff that we're talking about here today as we go forward, and how we are able to get this information out to our residents. So I'm excited about this. I think this is going to be a great committee going forward with these items for starters. I think we're going to have a little work ahead of us, obviously, when we start digging into the opioid stuff and the mental health stuff. And I think that, for the short term, I'm just, ecstatic we're going in the right direction. Doreen, anything you want to add to that, or are you just...
Yeah, thanks, Joe. I just want to point out that some of the people that we're going to be inviting to these meetings to help us with staff is with Chief Glover from the Police Department, Naomi Farrell from the Human Services, Paul Bentley, Human Services, Nikki Stevens, Human Services, Rosa Inchowski from Strategic Management and Diversity. And we have a number of those people on also right now. Naomi Farrell, Nikki Stevens is here, Octavia Harris, and let's see, Kristen Charlo is here, Levon and Marie Raymond. I just want to say thank you to all those staff members that are here with us today. And I know that moving forward, we're going to be asking and inviting other staff members to be a part of this process also. We're also going to be asking, stakeholders to be a part of process and stepping out and also talking to our community. So I think we have the opportunity to do really wonderful big things in the city of Tempe, and we can all do it together. So I'm really excited about being on this committee, and I'm really happy to work with you, Joel, and with Kristen and Tim, our aides. They're doing a great job. So I'm looking forward to what this is going to look like moving forward.
No, absolutely. This is great. I voice the same opinion. So thank you, Doreen. Okay, with that, we got down to C1, which is announcements. I have no announcements.
I don't have any announcements except for the next meeting.
Yeah. Tim, is there anything anybody needs to add?
No, sir, not this time.
Okay. So our next meeting is going to be Friday, March 26th at 12 p.m. So it sounds like a good place and time. And other than that, we got our list in front of us and we are ready to adjourn. So guys, thank you so much. This is a great start and excited.
Thank you, everybody.
All right, guys, thank you.
Thank you.
Thank you.
See ya.